What causes the tingling or numb sensation in your feet? Have you ever felt a tingling or numb sensation in your feet, like pins and needles, or a loss of feeling? This is a common problem that many people experience at some point in their lives. It can happen for a variety of reasons, such as sitting or standing in one position for too long, wearing tight shoes, or having a cold feet. Usually, it goes away on its own after a few minutes, as the blood flow returns to the affected area. However, sometimes the tingling or numb sensation in your feet can be a sign of a more serious condition, especially if it lasts for a long time, affects both feet, or is accompanied by other symptoms, such as pain, weakness, or swelling. In these cases, it can indicate that there is a problem with the nerves, blood vessels, or muscles in your feet, or that there is an underlying disease that affects your whole body. So, it is very important to pay attention to the tingling or numb sensation in your feet and to know what it means, and at the end, we will share with you ways to treat it at home. So, let's start by what causes the tingling or numb sensation in your feet. The tingling or numb sensation in your feet can have many possible causes, ranging from mild and temporary to serious and chronic. Some of the most common and rare causes are: number 1, peripheral neuropathy. This is a condition that affects the peripheral nerves, which are the nerves that connect your brain and spinal cord to the rest of your body. Peripheral neuropathy can cause damage to the nerves in your feet, leading to tingling, numbness, pain, or weakness. It can be caused by various factors, such as diabetes, alcohol abuse, vitamin deficiencies, infections, injuries, or exposure to toxins. Number 2, Raynaud's phenomenon. This is a condition that affects the blood vessels in your extremities, such as your fingers and toes. Raynaud's phenomenon causes the blood vessels to narrow and spasm, reducing the blood flow to the affected areas. This can cause tingling, numbness, coldness, or color changes in your feet, especially when you are exposed to cold temperatures or stress. Number 3, diabetes. Diabetes affects your blood sugar levels and can damage your nerves, especially in your feet. This is called diabetic neuropathy, and it can cause pain, numbness, tingling, weakness, and ulcers in your feet. Other symptoms of diabetes may include frequent urination, extreme thirst, dry mouth, and itchy skin. You may also have fruity smelling breath, increased hunger, and unexpected weight loss. Diabetes can be diagnosed with blood tests and managed with lifestyle changes and medications, such as insulin. Number 4, tarsal tunnel syndrome. This is a condition that affects the tibial nerve, which runs along the inside of your ankle and into your foot. Tarsal tunnel syndrome occurs when the tibial nerve is compressed or irritated by a nearby structure, such as a bone, tendon, or cyst. This can cause tingling, numbness, pain, or burning in your foot, especially in the heel, arch, or toes. Number 5, Morton's neuroma. This is a condition that affects the nerve that runs between the toes, usually the third and fourth toes. Morton's neuroma occurs when the nerve is thickened or enlarged due to repeated pressure or irritation from wearing tight shoes, high heels, or engaging in certain activities, such as running or dancing. This can cause tingling, numbness, pain, or a feeling of a lump in your foot, especially in the ball of your foot or between your toes. Number 6, Guillain-Barré syndrome. This is a rare condition that affects the immune system, which is the system that protects your body from infections and diseases. Guillain-Barré syndrome causes the immune system to attack the nerves in your body, resulting in inflammation and damage. This can cause tingling, numbness, weakness, or paralysis in your feet, legs, arms, or other parts of your body, usually starting from the lower limbs and moving upward. Number 7, multiple sclerosis. This is a condition that affects your central nervous system, which consists of your brain and spinal cord. It causes your immune system to attack the protective covering of your nerves, called myelin, which results in nerve damage and disruption in communication between your brain and body. Tingling or numbness is a common symptom of multiple sclerosis that could affect your body, face, hands, and feet. It may be one of the first signs of multiple sclerosis, according to the National Multiple Sclerosis Society. Other symptoms of multiple sclerosis may include fatigue, weakness, pain, itching, vision changes, and balance difficulties. Number 8, hypothyroidism. This is a condition that affects your thyroid gland, which is located in your neck and produces hormones that regulate your metabolism, growth, and development. When your thyroid is underactive, it can't produce enough thyroid hormone to support your body's needs. This can affect your nerves and cause tingling or numbness in your feet. Other symptoms of hypothyroidism may include fatigue, weight gain, cold intolerance, dry skin, and hair loss. Hypothyroidism can be diagnosed with blood tests and treated with synthetic thyroid hormone pills. Number 9. Sitting or standing in the same position for too long. This can compress the nerves that lead to your feet and reduce the blood flow to them. This can cause a temporary loss of sensation in your feet, which is often called going to sleep or falling asleep. This feeling should go away when you move your feet and restore the circulation. A pins and needles feeling usually follows before sensation returns to your feet. This is not a serious problem, but you should avoid sitting or standing in the same position for too long and move your feet regularly to prevent nerve damage. Number 10. Sciatica. This is a condition that affects the sciatic nerve, which is the longest and largest nerve in your body. It runs from your lower back, through your buttocks, and down your legs to your feet. When this nerve is compressed or irritated by a herniated disc, a bone spur, a tumor, or an injury, it can cause pain, numbness, tingling, or weakness in your lower back, buttocks, legs, or feet. The pain may be sharp, burning, or shooting, and it may worsen with movement, coughing, or sneezing. Sciatica can be diagnosed with physical exams and imaging tests, such as X-ray, MRI, or CT scan. It usually can be treated easily with rest, ice, heat, physical therapy, or surgery. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. So when to seek medical help for the tingling or numb sensation in your feet. While the tingling or numb sensation in your feet can be harmless and temporary in some cases, it can also be a warning sign of a serious condition that requires immediate medical attention in others. So, here are some signs that you should seek medical help for tingling or numbness in your feet. Number 1. It lasts for more than a few minutes or occurs frequently or constantly. Number 2. It affects both feet or spreads to other parts of your body. Number 3. It is accompanied by other symptoms, such as pain, weakness, swelling, redness, loss of bladder control, or skin changes. Number 4. It interferes with your daily activities, such as walking, standing, driving, or wearing shoes. Number 5. It occurs after an injury, infection, or exposure to a toxin. Number 6. You have a history of diabetes, kidney disease, thyroid disease, or other chronic conditions that can affect your nerves or blood vessels. Number 7. You are pregnant, as the tingling or numb sensation in your feet can be a sign of preeclampsia, a serious complication that can affect your blood pressure and your baby's health. By seeking medical help for the tingling or numb sensation in your feet, you can get a proper diagnosis and treatment and prevent further complications or damage to your nerves, blood vessels, or muscles. In some cases, you can treat the tingling or numb sensation in your feet at home by following some simple tips and remedies that can ease the discomfort and prevent further damage. Some of the things you can do are: Number 1. Move your feet. If the tingling or numb sensation in your feet is caused by sitting or standing in one position for too long, try to move your feet or change your posture every few minutes to restore the blood flow and relieve the pressure on your nerves. Number 2. Massage your feet. If the tingling or numb sensation in your feet is caused by muscle tension or stress, try to massage your feet gently, using your fingers or a roller to relax the muscles and stimulate the circulation. Number 3. Use essential oils. Essential oils can help soothe the nerves and muscles and reduce the inflammation and pain in your feet. You can use essential oils such as lavender, peppermint, rosemary, or eucalyptus by diluting them with a carrier oil such as coconut, olive, or almond oil and applying them to the affected area with a gentle massage. You can also add a few drops of essential oils to a warm bath or inhale them with a diffuser or a steam inhalation. Number 4. Warm your feet. If the tingling or numb sensation in your feet is caused by cold temperatures or Raynaud's phenomenon, you can try to warm your feet using socks, slippers, or a heating pad. This will dilate the blood vessels and improve the blood flow. So, these were the causes and some home treatments of feet numbness and tingling. Remember to consult your doctor if you have persistent or severe feet numbness and tingling, or if you have other symptoms. Now, we want to hear from you. Do you have some of these symptoms? What was the cause of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.